a funding cut has hit some long-term care providers in the province. The cuts have to do with overtime pay, and some providers say those cuts have already resulted in reduced services for the people living there. They're warning that if the support is not reinstated or a new model sorted, that it could lead to fewer beds, longer wait lists, and more pressure on families. So here with us in studio now are the leaders of two affected long-term care providers in the Lower Mainland. Janice Boyle is the CEO of Three Links Care Society. They operate Three Links Manor in the Renfrew Collingwood neighborhood. Janice, hi, good morning.
Good morning.
Thanks for being here. And also with us is Rob Gillis. Rob is the CEO of Haro Park Centre in the West End in Vancouver. Rob, good morning.
Good morning, Gloria.
Okay, Janice, for starters, just what kinds of long-term care providers are affected by these cuts to funding?
Well, mostly right now it's charitable providers of long-term care. And when these COVID funds originally came in, they were initially intended to be temporary. But the government recognized at the time that they were a short-term fix for a long-term problem. So long-term care homes, charities specifically, had been chronically underfunded for years. And so when these extra pots came in, that was a lifeline for those charities. And because of that, we were promised repeatedly throughout COVID that these extra pots of money wouldn't be cut until a new funding model was in place. And of course, they now have been cut. There is no new funding model in place. And the trust with government at this stage has really been broken.
And roughly how many operators like this operate in the Lower Mainland?
In the Lower Mainland, it's probably about 40 or 50, and charities operate about a third of all long-term care beds in the province. So this impacts a lot of beds.
And from what we understand, these cuts are related to overtime pay. Can you explain that in more detail?
Well, that's what the pot of money was created to help support, and because a number of conditions that started during COVID, overtime significantly increased. It became more difficult to get staff, and everybody's overtime bills have gone up. Now, what's not changed since COVID is that there is still a shortage of staff. And so our overtime has generally come down a bit, but that expense hasn't gone away for any of us. But even with all of these extra pots, we still are subsidizing these contracts. So, we get some money for overtime, or we were getting money for overtime. We were getting some money for wage leveling. But we were still subsidizing our long-term care contract to the tune of about $350,000 a year. And that's what most charities find themselves in, their circumstances. And they're doing it through things like, we have antennas on the roof for cell towers that we rent out. And we have seniors housing that generates a cash flow. And what that cash flow is supposed to go is into the bank so that when we need to replace the windows or the roof, we can do that. But at this stage, it's going to support our long-term care.
I see. Now, Rob, you run Haro Park in the West End.
Yes.
How have you seen things change since the pandemic for in terms of staffing and needed supports?
Well, a great example of that, Gloria, would be, for example, if we were wanting to hire an RN at Haro Park Centre, we would put an advertisement out, get a dozen resumes in, screen them down to the final few, and then hire one or two nurses to fill the hole. The challenge now is every single resume that comes in with the right qualifications, we're chasing after to try and get them to come into long-term care. And this is not a Haro Park specific issue. This is an issue at all of our other affiliate sites throughout the province. It's not only just for long-term care. It's also happening in acute care. My daughter is an acute care nurse in Royal Columbian Hospital. And I know she talks to me on a regular basis about how they are running short on their shifts.
Janice, is it the same situation for you?
Very much, yeah. It's hard for us to find nurses and LPNs. We have a little bit more success with care aides, but part of the challenge, too, is in long-term care and smaller facilities. We often can't offer these people a full-time role. They usually are starting as part-time. And so it's very hard to compete with the health authorities in terms of hiring these staff.
Only so many nurses to go around right now. And it's interesting. This actually came up in question period around the time the cuts took effect. And Health Minister Josie Osborne was asked whether they would reinstate funding. Just listen to what she had to say.
This is about working with the sector, not about fear-mongering and bringing in words that are striking fear in the families' hearts of people that need to know their seniors are safe. That's why we're going to work with the sector. Mr. Speaker, that's why we're going to continue rebuilding long-term care and supports for seniors after they were devastated by the members opposite.
So that was BC Health Minister Josie Osborne during question period, and she was responding to a question about whether the ministry would reinstate COVID-era funding for long-term care facilities. I didn't hear a yes or a no there in the minister's statement. Rob, have either of you heard from the ministry on this?
No, not Janice, not myself, nor anyone in the Vancouver Coastal Administrators Council, which is a group of home administrators like ourselves whom run these charity-driven sites. We're not owned and operated by Vancouver Coastal Health. Further to that point, it's like a two-tiered system is being put in place here because Vancouver Coastal Health owned and operated sites don't have the same restrictions on overtime as us affiliate sites do. So we are registered charities. We are private entities. We have this overtime ban implemented on our sites, but not on the Vancouver coastal sites. So it's kind of creating a two-tiered system. If you're lucky enough to have your loved one put into a Vancouver Coastal Health owned and operated site, they don't have to worry about running shifts short of staff. And when shifts get run short of staff, that turns into real outcomes for our, not just our staff, but for our residents. For our residents, for example, in the first 5 days of this ban being in place, we implemented the system at Haro Park so that we could only replace staff at straight time, not at overtime. On one of the first 5 days, we had to cancel having breakfast down in the main dining room, and all the residents had to eat breakfast up on the floor because we didn't have enough staff on to get everybody properly prepared to bring them down. It wasn't an option. A couple of days later, we had a similar situation where care aides called in sick. So we have a designated bath team at Haro Park. We had to pull one of those members that are a care aide that are doing the baths to do the bedside care to meet our care standards and our care regulations. That meant some residents that day that were expecting a bath didn't get their bath.
I see.
That's a big deal.
Janice, what have you seen? Any similar examples? I mean, these cuts to overtime pay started October 31st.
Yeah, we had a very fortunate week right after the ban where we didn't have much overtime, but we have been doing a lot of shuffling in terms of making sure shifts are covered. And the first thing that happened to us is we have an LPN that's kind of designated to help with admissions. And so when an LPN calls in sick, we will take that LPN who's focused on admissions and put them on the floor. And so that's been delaying new admissions into the facility. And so that is a senior that is now waiting longer in acute care to be able to get into long-term care. And that is a huge difference for their families.
Okay, I'd like to hear from each of you. What's the resolution to this, Rob?
Well, number one, instead of giving us 37 days notice of this cancellation of overtime, it could have been phased in over a period of time to give charities like ours the opportunity to strategically plan moving forward how we're going to deal with this situation. We need to ensure that we're providing all the care that our licensing regulations require, but at the same time, we still need to stay solvent. If this funding doesn't improve, if we don't have this corrected funding formula, then we need to start worrying about the future of societies like Haro Park and meeting our mandate of providing subsidized care for those that can't afford to pay for private care. What that is going to look like, who knows? Janice,
what would you like to add to that?
A new funding model, and I don't care what you call it, COVID, temporary, short-term, but we need something in the very short term to replace what that COVID funding was giving for us. If we don't have a replacement for that, at 3 links, we can run out of cash potentially in about 18 months. And so what that means is we're going to have to sit down with our board in January and decide, whether or not we can continue with our long-term care contract. And we've been doing this for 45 years. That is not a discussion we want to have, but we're going to have to.
I want to thank you both very much for joining us this morning. It's an important conversation. Well, we'll see what transpires in the coming weeks. Thank you.
Thanks so much.
Thank you, Gloria.
Janice Boyle is the CEO of Three Links Care Society. They operate Three Links Manor in the Renfrew Collingwood neighborhood. And Rob Gillis is the CEO of Haro Park Centre in the West End in Vancouver.